The head of the NHS Test and Trace programme in England, Dido Harding, has admitted that no one expected to see the huge increase in demand for tests that has happened since schools went back. During tough questioning from MPs, she said there'd been a significant rise in the number of young children and teenagers going for tests, with demand now 3 or 4 times higher than the daily capacity allows. Our health editor, Hugh Pym, has more.
I'll show you where to step. That's okay.
Sarah and her son are looking forward to a new member of the family. She's 41 weeks pregnant and was due to have an important midwife appointment. But she had to postpone it as she had a cough and needed a test, but couldn't get one on the official website.
It's really important just to put my mind at ease that everything's okay with the baby. And it's frustrating, not knowing, not being able to get the care and not being able to get the test. I don't know how my care is going to proceed.
Paul, who's a teacher, has been trying and failing to book a test for members of his family.
4 days of trying to get testing and nothing at all. Not even being offered testing, 100 or 200 miles away, which at this stage I would take.
If there was frustration for people at home, there was even more for those in Sutherland who secured a booking, arrived at the site, but found no sign of any testing.
It's an absolute joke. I've got to bring 3 kids out of school. They're now missing out on a vital education because of this COVID-19, and there's not one person turned up onto this site.
Nobody here. So, what do you do? So we'll just have to go back home and try again, I guess.
It beggars belief. It takes you ages to get an appointment. Then you come and there's a car park full of people and there's no testing people. It's just ridiculous.
Elsewhere, though, some other testing stations like this one in West London appeared to be working normally. At this testing centre, people who've managed to get a booking are moving through. Each morning there's an allocation for those who haven't booked and just turn up. But people arrive very early, and it goes quickly. One of those who did get a slot here told us it had meant a long walk with her child.
Tried to get a home test, missed that this morning. They'd all gone by the time I filled it out. Missed the more local ones. We've actually just walked 6 miles to get here.
In the Commons, one cabinet minister gave his opinion.
Instead of this endless carping, saying it's difficult to get them, we should actually celebrate this phenomenal success of the British nation in getting up to 250,000 tests of a disease that nobody knew about until earlier in the year.
The head of Test and Trace in England told MPs that experts hadn't predicted the surge in numbers wanting tests.
I don't think anybody was expecting to see the really sizable increase in demand that we've seen over the course of the last few weeks. So none of the modelling was that expected. And that's why I say I think we all have to think really hard about how we prioritise the use of these tests, that we're clear that you should only get tested if you have the coronavirus symptoms.
The latest data for test turnaround times in England for the week ending September the 9th showed that just 65% of results were sent to people the next day, down from 89% the previous week, and only 33% within 24 hours. Testing sites are operating, but slots are being limited because laboratories to analyse tests are overloaded, and ministers admit it could be a few weeks before that's dealt with.
And Hugh is with me now. We've got a better idea of the pressure the system is under, with demand 3 or 4 times greater than capacity. The question is how this can be resolved quickly.
Well, Sophie, Ireland's Health Minister Paul Reid said today that UK officials had approached him earlier in the week asking for help getting tests analysed in laboratories. And he said in his view, quotes, the UK system was almost in collapse. Now, the Department of Health has indicated tonight it's not unprecedented to have tests analysed outside the UK, and they referred me to remarks by Dido Harding earlier, the head of Test and Trace in England. She said she strongly refuted the system was failing. A key bit of her evidence, though, was over this issue of why capacity in labs hadn't grown fast enough to meet the recent spike in demand. And she said the plans had been based on modelling by scientific advisors on the government's SAGE Advisory Committee. Now, you're not going to get new labs on stream overnight. The government will hope people get the message about not getting tested unless they've got symptoms. But certainly there's a real problem out there for people, often key workers, stuck at home wanting to get tested, but who can't do so.
Hugh Pym, thank you. Well, the latest government figures show there were 3,395 new coronavirus infections recorded in the latest 24-hour period. It means the average number of new cases reported per day in the last week is now 3,354. 21 deaths were reported of people who died within 28 days of a positive COVID-19 test. That means, on average, in the last week, 14 deaths were announced every day, taking the total number across the UK to 41,705. Care homes in England are set to receive more than £500 million in extra government funding to help them tackle the coronavirus over this winter. The money will help pay staff full wages when they're self-isolating, reduce their use of public transport and ensure staff work in only one care home. Tomorrow the government will outline a plan to protect care homes from coronavirus over the winter months. Our social affairs correspondent Alison Holt reports.
They've had a lot of apples on there, so they...
For Doreen Amos, these warm September days are a chance to enjoy the garden at Pelham House Care Home in Folkestone before the chill of winter.
It is, yes, I love lavender. Yeah, now that's better.
The home lost 10 people, half its residents at the height of the pandemic. It cares for those with dementia. And now COVID-free, it's trying to make life as normal as possible for Doreen and others.
Well, it's very relaxing, yes, and I'm quite happy, yes. And the meals are good, and I've got a nice room.
Find the corner of this
carpet. Yeah, I will, yes.
Today's announcement of extra infection control money is to ensure staff are paid a full wage if they have to self-isolate and to limit the use of agency workers. The aim is to protect care homes from another wave of the virus, already a worry for many.
With the flu and even, in the winter every other year, the hospitals are full up, so now with this on top, I'm terrified, absolutely terrified.
For Karen, the home's relief manager, better testing is the highest priority.
Last week we were tested on a Friday and got the results the following Friday. So for that whole week, everybody is on tenterhooks the whole time, not knowing whether they've actually got it, because the first time round, a lot of us were asymptomatic, so didn't even know we'd got it.
The high number of deaths in care homes has not surprisingly had a huge impact. Many care staff will say they're still exhausted, they've had little time to grieve, and there's nervousness about what lies ahead. The government will publish its winter support plan for social care tomorrow. Many care providers say more medical and financial support are essential to help them cope this winter. With fewer residents, Pelham House has had to take out a last-minute business loan to survive. Its owners sceptical about whether ministers will provide the help they need.
We certainly could do with more practical help and support, and I still feel actually that there's a disparity between where we are and what we need, and perhaps what the government says and what it does.
The government says it's making testing care staff a priority and that from the start of the pandemic it's been doing everything it can to protect care home residents and staff. Alison Holt, BBC News.